even gatherings within the streets that are unnecessary should not be held. Stay at home.
And if you don't get that message, then you need to find out what's wrong with you.
That was not you.
You say you need to find
No,
out
you
what's
have
wrong with
edited the
you.
message. You have edited the message.
That's
It
right.
began by any gatherings in the streets which are not necessary. I require definition here. What is necessary?
Which
What's a necessary
gatherings are
gathering?
necessary?
Yes. It should just have been do not,
Congregate anywhere.
no, do not leave home. If you start from there, there's no ambiguity. So the issue of even meeting in the streets doesn't arise. Or if there's another statement that needs to be made, it has to be clear. That one is ambiguous.
All right, so let's welcome our guests. Thank you very much for joining us, Dr. Mercy Mwangangi. You haven't been... it's one of those seasons. This is peak season for you. And thank you for serving the country. Karibu to the Situation Room.
Thank you. Happy to be here.
Good. Now, you heard what CT Muga is asking. What is an essential or necessary gathering?
Right. So let me backtrack and start at the beginning when it all began in China, Wuhan, probably around December last year. Response to this virus, one, has been guided by experiences that are happening in other countries because, one, this virus is new. This virus is, we would say, almost 4 months old, and we would be celebrating the 4-month-old birthday of this virus. So it's something new. We are still learning. Scientists are reviewing and trying to understand how is it transmitted. Now, I'm trying to lead us on to the gathering issue. So far, we know that the virus can be transmitted through droplet infection. And when we say droplet, we mean particles of the virus that would be in your saliva. And when you sneeze and that action of propulsion from your mouth and that, force, if it lands on your eyes, in your mouth, anywhere where there's what we're calling mucosa, or you breathe it in, you're then infected with COVID-19. Now, COVID-19, through this mechanism of coughing and having the droplets spread, one of the main ways, therefore, fighting against it is by maintaining that social distance, ensuring you're at least a meter apart. Some people, some studies, some scientists are even recommending 2 meters apart. And so when the CAS talks of gatherings, any gatherings and their necessity, what he's alluding to is we have directed stay at home. One, if you can work from home, work from home. But then, of course, the government is cognizant that we live in a largely informal sector with an informal labor force. About 80% of Kenyans are in the informal labor force. And part of these gatherings may constitute what they consider to be work. What we're saying is, if it's not necessary for you to be in that gathering, humped up together, less than a meter apart, then you do not need to be there. And the thing is, the virus is new. We're still learning. We're still trying to understand it. We're even trying to see, is it airborne? The study is currently going underway to see, is this virus airborne? And you can imagine the repercussions of if it were.
Wow.
So right now we're trying to protect our citizenry, to protect our country. And indeed, yesterday I came across a very good meme. You are actually the vaccine for this virus. There's no little chemical that's, being made that we then give jabs. You are the vaccine. You're the social vaccine of this virus.
Dr. Mwangangi, we talked just before you arrived, and just looking at, okay, then what is the problem? Because over the last 2 days, we've seen people who are clearly not getting this memo. A lot of people in this country, and we're saying, okay, so what is it going to get to get us to that point where this message sinks in?
So, indeed, we've received reports, and we've seen it ourselves in terms of our surveillance. It seems that Kenyans are being casual with this disease. And, if you look at the trajectory of different countries, and this is radio, I would draw it for you. I'm not sure how you describe a graph, but if we look at perhaps the first 10 countries in terms of how they responded to this COVID issue, you'll notice that in the first week, it was just like Kenya. 1 or 2 cases, 3, 4 cases in the first week. And countries who then jumped in immediately and took certain kinds of measures were able to do what we're calling flattening the curve. countries who perhaps undertook a different approach. And here I must say that at the end of the day, there's really no, should I say, right or wrong report. It's a lot about domesticating it for your country. And then, of course, getting the data that's coming in from the scientists, from WHO, from CDC, and understanding what our engagement should look like. So you'll notice that some countries and most of those who did not closely adhere to the social distancing had a steep increase in the number of cases. So we are a little bit disturbed when we see the casual nature within which Kenyans are, undertaking these measures. And starting today, as the Cabinet Secretary directed, there will be utilization of the administration police in trying to mitigate against these gatherings. If you do not need to be huddled up, stay at home. Yeah.
But is it Kenyans taking it casually, or is it that the directives being given are not straightforward, as City Mugas kept asking? Because if you're like, we appeal, we urge you, and then stay at home if you don't have to go anywhere. Everyone has somewhere to go.
Avoid meeting in the street. That means you're already out of your home.
If the directives are not clear and obvious, can you really blame Kenyans for finding things to do? Because everyone is busy.
So yes, I mean, and that's a good insight. And the National Emergency Response Committee is evaluating. It's important for people to understand, one, it's a new disease. And like I said, there are many, should I say, varied measures and factors that need to be taken into account when you're deploying a certain intervention, especially when it's an intervention that not only touches on movement of people, but also on the economy, on labor, on access to services and utilities.
Yeah.
And so the government has been meeting, is engaging. There are many stakeholder teams who are reviewing the situation. And it's important to know that part of our response is not only guided just by, should I say, government procedure. We are actually engaging with WHO. We're actually engaging with CDC. We're actually engaging with the African CDC. And part of our response measures are guided by that situation analysis of what's happening globally. What you will see going on, and especially as we continue ramping up testing, which is what we'll be doing within the coming weeks, as we continue employing different intervention measures, we definitely shall be, perhaps, should I say, more firm and direct with our instructions. But you have to appreciate this is a dynamic, ever-changing situation that needs to be balanced in terms of how we approach it.
If we were to say, Eric, please.
Well, I was about to say that this committee was established soon after the furore over the China Southern Airline. And this is when it came in. And the issue was, why are we allowing people from other countries that have already reported cases of coronavirus to come into the country without follow-up measures, without proper quarantine guidelines? And since then, up to date, until the CS talked about, better measures yesterday in terms of this is a government-mandated quarantine facility, we still have been having grey issues of quarantine. Why is it taking so long to just decide on the issue of quarantine and manage quarantine?
Right. And on that, what are these government-mandated quarantine areas? Because as at yesterday evening, I was getting calls asking me where or which are these facilities, and there seemed to have not been any clear indication of which facilities these are and why those particular ones.
Right. So let me begin by perhaps also demystifying what quarantine is and what isolation is, because that's where we get our base of this discussion.
Okay.
So when we say we are employing quarantine measures are utilized for people who may have come into contact with suspected cases. So people who are put under quarantine are not positive cases. And I hope that's really clear. So a quarantined individual is one who, for example, may have had an encounter with someone who may have been confirmed to be positive. Now, isolation, which is important again for us to distinguish the two, isolation takes place when you are already confirmed and therefore you're in a treatment and management facility and you're being isolated to avoid you, who is the positive confirmed case, from coming into contact with any other, people who may be susceptible. Now, in terms of our response, again, we are making heavy reference to what different countries have employed. Remember, this is a new virus, and we're trying to see how to deploy our interventions. When China initiated their response, I'd like to, if you allow me, just thank the Chinese government. They've been very helpful to us, and we're in constant communication with them. And I'm sure you saw we had a teleconference with them yesterday, and the day before, even with their Director General of Health. this is what he told us. He told us we had to be, should I say, dynamic in our response. In the immediate phase, they actually advocated for self-quarantine. Go home, stay at home, as the situation was evolving. Immediately they checked and so, oh no, this intervention might not be yielding the fruits we're looking for.
Because people are not.
So why don't we then escalate this and have some form of mandatory quarantine put in place? Now, this was happening. Remember when this happened in Wuhan, that was the focus area. That was the epicenter. This had not spread across the world. Little did we know, because it's a new virus, when China was mounting its response, Europe and the rest of the world, we were watching. We were evaluating the situation. We were not aware that this virus that is unknown had already crossed borders and was actually now mounting, should I say, an undercover attack for the different continents and countries. And so when we had Kenyans, agitating for closure of all, incoming flights early on into the phase of this disease, and more particularly targeting Chinese flights, all the while now, when we review our data now, and even then, we realize that the threatened target was not going to come in from China, that we had actually had seeding already in Europe, and our targets were either, our fast transmission cases, should they occur, and more like when they occurred, were going to happen from Europe. Now, the team that's meeting, the NERC team, has participation of high-level officers who are in transport and immigration. You can imagine the air traffic that Kenya has, serving as a hub, a sub-Saharan Africa hub. So the first time we were told, try and stop China flights, we were reviewing the situation, and data was saying, no, perhaps you need to look at all these other entry pathways that you have that are numerous. And then in came the question of connecting flights. So you remember, someone can move from South Africa, jump across the continent, all the way to Kenya. There were heavy factors that needed to come into play, and no country in the world was able to deploy the measures until the data was able to be convincing that now is the time to deploy that measure. And what we're trying to tell Kenyans, that this is a time for us to deploy that measure.
So then shouldn't it come out that way though then?
Right.
Very clearly. I mean, without space for any kind of questions or ambiguity. Should I, shouldn't I? It should then be very clear to people, because I think this is the problem. People are doing this dalliance with, is it okay or should I not? Because it hasn't come out clearly that you should not.
I understand. And I think perhaps what we'll do is we'll refine our communication and, be more firm. But then there's a question perhaps that, I haven't answered, and I was touching on to it. So what did China do when they had to execute mandatory quarantine measures? Again, looking at their economical, ability and their strength as a country, which is varied across the countries in the world. China was able to deploy hotel institutions to quarantine, their patients. Remember, China was able to deploy a facility within, was it record 7 days? I can remember.
1,000 bed capacity.
Exactly. And they were able to put in place those, should I say, mandatory quarantine measures. The cabinet secretary yesterday announced that we shall also be deploying this. And I'm sure you've seen clips of Uganda also deploying this very same measure. In Kenya, we are assessing. Within, of course, the next 1 day, there will be instructions from the NERC of where these quarantine centers should be. I'd like to inform members, and this is to that point, this assessment of where we can quarantine Kenyans has actually been underway for the past 3 weeks. What we're trying to do is finalize on the final logistics, and I'm not in a position to be able to make that announcement here. The cabinet secretary will be able to take that forth, but we are ready. Right now, anyone landing in JKIA today, we have, mechanisms of where they'll be placed. Now, there was an incident that came across in Italy, and that's why we are perhaps taking caution as we share this information, and it shall be relayed at the appropriate time. A small village in Italy or Spain, one of the two countries, was should I say, circumscribed for quarantine. There's a facility that was put aside for quarantine. it required engagement with the community there. If you saw, there's a bit of a scuffle there with the village because they felt you're bringing in people into our village. We don't want to cause unrest. We don't want to lose the public trust. So this is a situation that needs to be governed with the seriousness that it brings. And so Kenyans should be assured we are aware. We know where our quarantine facilities are.
You're speaking very well, and you're saying yes, there's assessment from the very beginning, from December, from January when China was taking in those measures. However, I feel that the government of Kenya is pussyfooting on decision making. Look at Rwanda. Same, they are still assessing. Look at Uganda, they're also assessing. But they have gone straight and said, all right, so this is what we're going to do. And they are clear. I think the issue that we're feeling is coming from the government is we don't have clear communication. And also, it's not yet, the government has not yet decided. When the CAS stands up on Sunday and says, when you arrive, you're going to go into a government-mandated quarantine facility, and yet is not saying these are the quarantine facilities.
So, and that's the point I'm trying to emphasize here. It doesn't mean that we do not know where these facilities are.
Tell us.
No, I cannot tell you those facilities.
Somebody was calling Dr. Marcy from the airport last night and saying, I have arrived. I'd like to know where to go.
Right. So this is how we're going to manage this, right? So the quarantine facilities are available. The quarantine facilities are known. The quarantine facilities are designated with officers who will be able to receive these individuals.
For now, they're top secret.
And right now, allow the cabinet secretary to be able to make that announcement as to how these quarantine measures will be undertaken. Remember, we do not want to cause unnecessary unrest and panic in the community. We do not want to handle this situation in a way that we are not able.
Dr. Mwangangi, that's perfectly understandable. However, look at a situation whereby people arrived last night. They should go into quarantine, right? As we are looking at it, should go into quarantine. But what are they told? Go home, self-quarantine for the night,
Come back.
and then present yourselves tomorrow morning. What kind of mechanisms are in place
now
to make sure that
spreads
they come back
panic and
that
that
spreads
fear.
panic and fear.
Because when this person comes into my estate and I know that this person
just arrived from
abroad,
Right.
what do you think this whole community is going to
Exactly. And I mean, these are valid concerns. By no way are we dismissing the concerns that Kenyans have. What we're saying is that we do have a mechanism in place and we will follow up. So I'm quite interested in knowing, what that flight was, what those, who is that who came in last night and was not able to be quarantined.
You just told us you know these things and you understand.
We do
Look, first of
know
all,
these things.
This job of yours is not an easy one. It can't be easy. Because clearly there are things you cannot tell us that we understand. And one of the things that I'd like to ask, if it falls in the realm of things you can't tell us, then you will not tell us. But are we really prepared for this?
Yes, we are prepared. I need to, demystify perhaps again how this response is being carried out in different countries. It's important to notice that COVID-19 is not just affecting your health. COVID-19 is affecting our economy. COVID-19 is affecting the very livelihood of who Kenya is. So indeed, the government is very well seasoned, prepared. And perhaps if I could do, a quick run of, preparedness measures.
Please.
Do we have quarantine facilities in the country? Yes, we do. Are these quarantine facilities able? So that's part of what I was going to lead on to. Are the quarantine facilities able to quarantine any, the numbers that we would need? Yes. Have we engaged with the business and private sector to see how we can buff up our occupancy of quarantine centers? Yes. Are we in discussions right now with these people, with these teams as to how, we'd be able to have those rooms and reserves in place? Yes. Have we looked and seen how many people did China have to quarantine? Do you have that capability? Yes. We're looking at the numbers and data. 2, the other response would be on, the isolation and treatment centers.
Yep.
Do we have adequate isolation and treatment centers as we assess the data that is coming in? Yes. Are we working to beef up and to ensure that should our numbers reach, Italy proportions in terms of the response measure, that we have the adequate measures in place? Yes, but here there's a caveat. There's a resource constraint, and so we are working to mobilize more. Remember, you've seen in Italy, there's been a need for increased numbers of, ICU beds and facilities that are of critical care in nature. This morning, I know there are teams who will be sitting to review and see how do we mop up and scale up these, critical care facilities within the country. Now, testing is another issue I've seen many people asking about. Are we prepared in terms of testing our Kenyans? Yes. This morning, we'll be scaling up testing facilities from our 2 to a more additional testing facilities. These testing facilities will be deployed using the old, should I say, provincial setup in the country. So you'll have different centers that will cover the populace in the different parts of the country. Those will be deployed today. Now, another very, very critical, important area, are our health workers ready? Our health workers ready and protected for this? In the beginning, we had challenges. The equipment gear was not enough, but now we've deployed. We're actually having an incoming set coming in today. So our health workers will be able to be protected. Now, another area that's, is bringing a lot of questions, the drugs. Is there a drug for coronavirus? Is there a medication that people can utilize? And the answer to that right now is no, not yet. Yes, we saw, FDA make an announcement on this, but it's important for Kenyans to know WHO is running a clinical trial, and everything that you're seeing in social media concerning the different, tablets that are said to have an effect. Do we have stocks of this in the country? We do. Will we deploy them once we get the proper protocols and guidelines from WHO? Yes, we would. So on all fronts, I must say, and this is not just, should I say, a self-assessment of our country, but an assessment which we're actually undertaking with China and Europe continuously, having marked checklists of where are you, Kenya, are you ready? Africa CDC, where is Kenya, are you ready? We're on course.
If we were not ready, would you actually tell us?
Well, now, a very key important point. If you're not ready, do you tell your children when you're not ready,
No,
perhaps
you
to
don't.
pay their fees, perhaps to feed them, the few times you've had challenges with your
Yes.
family?
I actually find that, to answer your question directly, yes.
Yes.
It is a perfect opportunity for your children to understand certain realities.
Right.
Your fees will be delayed.
Right.
This is what's going to happen.
Right.
We are not going to be eating this
Right.
because of this.
Right.
We underestimate the capacity of our children and we overestimate our role in parenting them. So we sometimes feel there are things we shouldn't tell them when in reality we should. They
But
then,
honesty is the best policy.
yes,
in
they
terms
grow
of
up with
how
a certain sense of reality. So even as they go about life, they understand that these things are. And what is amazing about children, they adapt to it very quickly once they've understood.
I think
Indeed.
the best example for this was an analogy by Trevor Noah. He says when a pilot comes up and says, "We are going to experience turbulence. Be prepared. You're
prepared.
You're prepared." Then when you get to turbulence, you know, oh, this is what he was talking about. But if the pilot doesn't say anything and then you're in turbulence and then he says, "No, we are doing okay. We are fine."
You're like, yeah,
And
right.
that's
Yeah.
Fall through the sky.
Dr. Mercy, I agree. And if ever there was a message of prepare for turbulence, I think the Cabinet Secretary gave it yesterday. This is not a joke.
We're already in turbulence. by
This
then,
is not a
Dr.
joke.
Mwangangi.
Exactly.
Don't you think we're ready?
And that's what I'm
We're already
saying. This
feeling
is
the bumps.
not, but that's just it.
Yeah.
And that's the casualness. And in fact, I'm finding it very, should I say, curious that people would think or, would want to misread in between the lines to hear.
Allow us to
We are now in turbulence.
allow us
The
to
pitch.
educate you on this particular matter.
Yes.
It isn't that we have a problem with what CS Kagwe is saying. It's a general problem of mistrust with the government.
Ah, okay.
When the government says something, when you look at the long history of things they have said and they haven't done, this just follows in that long
It's
list.
one of them.
It's not new. Government is speaking.
So
In the
perhaps
studio
what
this
I would
morning,
say.
sorry, Dr. let me just say this. In the studio is Dr. Mercy Mwangangi. She's the Chief Administrative Secretary in the Ministry of Health. As we go into the top of the hour, we take a look at traffic and then the conversation continues with Dr. C.T. Muga. What's today's proverb?
Today's proverb is, if you are filled with pride, you will have no space or no room for wisdom.
If you're filled with pride, you will have no room for wisdom. You'll give us the context of that because just like a preacher, you're pointing at someone. All right, this is the Situation Room continues. We'll be opening up the phone
have
lines in the
church
next hour. 0719 012 600. 94.4 in Nairobi, Mombasa 87.9, 102.5 in Kisumu, Nakuru 96.0, 96.7 in Eldoret, 90.9, Nyeri 97.7 in Malindi, www.spicefm.co.ke. We're also live streaming on Facebook and YouTube, Spice FM KE. In the room, we also have, in addition to CT Muga, myself, Eric Latifa Nduoko, we have Dr. Mercy Korir, KTN's medical journalist, and Dr. Mwangangi, the Chief Administrative Secretary in the Ministry of Health. Now, many people who do not know who CAS are, he basically is the Assistant Minister in the Ministry of Health. Asante sana for coming in, Dr. Dr. You have a question for Dr.
Yes.
Nice.
Okay.
Mercy has a question for Mercy.
No, so now somebody on Twitter was saying after staying in the airport for an hour waiting to be told what to do, finally they were given an option. One, you go home, then you show up at KNH for testing. So already there's a risk there. And then the other option is to go to a government mandated quarantine facility, or two, to go to a hotel, which costs them $100 per day. So if they are to stay in quarantine for 14 days, that's 140,000 Kenya shillings. And these are Kenyans. These are not visitors, or these are Kenyans coming back home before the 48-hour deadline lapses. So who has 140,000 to stay in a hotel?
Right. So what's important to note is, as you were speaking, I was computing. I'm a health economist. So I was computing the costs to the system, the costs to Mwananchi. Yes, this individual, like we've rightly said earlier in our show today, how are we managing this quarantine situation? Where are these facilities? And I've assured you the facilities are there and are available. But it's important to recognize that the Kenyans who are coming back in and are coming back home need to understand that they need to protect the country. They need to protect the 47 million Kenyans who are here. And the measure of saying, you have $100 in a mandated, in a hotel, so 1,400 by the end of those 14 days. Let's talk about the cost of what it would take if this person actually did not take upon this cost and was able to seep into the country and transmit this disease. The government is not saying that we are not aware that this will come at a cost. What we are saying is we need to work together. We need to know that this is a new situation that's evolving. We need to know that we're working in a space of financial constraints. And therefore, if you're coming in, I would say, go to the mandated government facility. Go to that facility. And I've heard you this morning saying that we need to be clearer in how that process is. And I will give you assurances that we'll be working on that today to communicate better how that will work, how you check in, how you get to that facility, who transports you, how we log your details, and how we get in touch with you. That we will work on, and we will streamline that. But remember, if you're coming in, you also have a responsibility to protect your country.
Absolutely.
But already those people from yesterday made their own way home, and today they will make their own way to Kenyatta National Hospital.
Right.
So within those 12 hours or so of making an announcement by the Cabinet Secretary, we don't know the number of people who have come in and who they would have interacted with.
So, yes, Dr. Indeed, we were looking the other day, a very curious statistic, that in one day, an individual may interact with up to 500 to 1,000 people unknowingly as you go around your normal duties. That varies in different communities with different engagements. So, for example, yourself, today, as you came in to work, who did you meet? So there's the people you slept with in your household. There's a taxi that you got into or the car that you drove in. Perhaps the guard at the gate, who then remember had interacted with other people and will go back home to interact with other people.
It's the networks.
So it's the networks, right? So, yes, 12 hours. Do we know the Kenyans who came in the past 12 hours? Yes. Is there a risk for if any of those Kenyans, left the airport and went home and therefore interacted with other people? Yes, indeed, there's a risk. But like I said, we are deploying these measures. We are learning. That's a big lesson learned. 12 hours, big lesson learned.
Yeah.
So today we'll deploy firmer and stricter measures.
Just
And
what
like
I'm
we're
talking
saying,
about pussyfooting on decision making. This learning started in December, in January. We knew, right? When you talk about networks and all, I mean, you're looking at the experiences, what you're seeing in China, what you're seeing in Europe, what you're seeing in America. You can see clearly this is how this virus is spreading. Now, when we say that for all this time, we've been talking about people arriving at JKIA and still not having proper measures of minimizing their contacts, but also just leaving them. So, yeah, take your own taxi, get home, share a cab, whatever, get home, leave, self-quarantine if you so wish. We really trust that and believe that you understand that this is a serious thing, that you shall self-quarantine in a family, in a household that has other family members who are completely not exposed before you got in. And then those people leave and they go to work and they leave you self-quarantining in the house. This is where I'm saying, look, lessons should have been learned earlier, but that's not the point. I wanted to ask the question that you've talked about now, that $100 per day. And earlier you had said that the government is in talks and negotiations with some of these private sector players. These are, I would imagine, hotels and all, to talk about how best to offer these quarantine facilities. Are you not talking about the cost and seeing how the private sector can also lower the cost? Maybe the government foots part of the bill so that the people, the private sector person does not feel that they're operating this facility at a loss, but also that it's not expensive for somebody who's coming in.
And
because
that's why
the truth of the matter is, yes, I really love my country, I love my home people, but I don't have 140K extra.
And that's why I said there are procedures and negotiations that are underway. And you've just described how a negotiation takes place. So that's exactly what's happening right now. But like I said, even before we get to, should I say, the private space, where you're having, different players saying, oh, I have a facility that you can utilize, or I have, accommodations that you can utilize. We're looking at provision already in our government facilities, which can be utilized. And so those measures and discussions are underway. I would give Kenyans comfort. And last night, I think there was actually a team tabulating everyone who landed yesterday and what we would need and how the situation will look like between between yesterday to Wednesday, how that would look like, and even post-Wednesday, how that would look like. So their team's working. If you remember, I think the president, in one of his directives when he was speaking to Kenyans, was able to say, we are talking with the business community, we're engaging with them, and we're looking at the role they play in this, and the role that they play in also protecting the country and protecting Kenyans and contributing to this fight. So those discussions are underway.
We have KCB, we know on Friday, mentioned that they put 10 billion Kenyan shillings towards, doing their part in alleviating the discomfort that Kenyans may face economically. Now, other players would be industrialists, and among these would be pharmaceutical companies and people who make equipment, people who do all sorts of things that would help alleviate what we are now discussing. Now, again, this may fall in the realm of those things which you cannot actually publicly discuss, but the question has to be asked. Are we discussing this thing with a view to telling Kenyans what the country has in store for them and what the country has prepared, or are these things going to be in discussions indefinitely?
Right. So good question. Again, looking at how different countries responded, right? So China, I think Singapore, most recently, I think on the House of the Floor, in Congress, there was a debate that was taking place, I think 2 weeks before they made a decision and a determination as to what finances would be put in, should I say, the economic space in terms of mitigating COVID. Last week, the president was able to have a very high-level discussion with private sector players within the country, and there were discussions and, should I say, a very clearly articulated mitigation plan as to how we'll all contribute in lessening the punch that coronavirus has given us. So yes, you do not discuss to discuss for folly, but you discuss to deploy an intervention. And this is indeed what we are working on.
Your job, once again, is an unfortunate one, but misfortune notwithstanding, okay?
This discussions, and I think learning from China, as you keep saying, we are learning from China and other countries, we realize that we are always a step, a week or two behind the coronavirus. So if the discussions are still continuing and we know for sure we are playing catch up to this virus, wouldn't we be caught?
Epidemiologically speaking, we should be ahead of this curve, should we not?
We should, because we knew we had 2 months plus up head start.
Not government preparedness speaking, just generally speaking, when it comes to cases of this sort, if you really want to contain it, you actually need to be ahead of it. And we've had ample warnings.
Right. So, and I was trying to see if I can draw the curve here for you to try and explain to you, you know, what it means being ahead of the curve. So I think you've heard of people saying when you have a fast pandemic, right? A quick pandemic, because it's across all different continents in the world, right? So a quick pandemic would mean you have an increase in surge in many cases. So it's a surge up, and then it comes quickly down, right? So it surges quickly, you know, it comes down, and the duration of the pandemic is short. Now, you've had us saying we're trying to flatten the curve, right? We're trying to have a slower pandemic. A slower pandemic, of course, then would mean it's you know, it's around for a longer time period, right? Compared to the fast pandemic. Now, you've asked a very, you know, important question. Are you ahead of the curve? So then the question would be, what is that measure? What is that threshold where you know, right now I'm ahead or now I'm behind the curve, right? And what we're seeing is that measure is a factor or a function of preparedness on many different levels. There's economic preparedness, there's preparedness in the facility, there's preparedness of the health workforce. There's also community engagement and contribution in terms of this function and how you respond. When you look at all these factors, depending on all the players in this factor, which starts with Mwangangi, you, the Kenyan government, that is duty-bound to protect its citizens. All the different players that we've discussed, who all have interactions, including yourselves, who are actually talking to a large number of people, and therefore your change agents. You all determine how we flatten this curve. Now, are we getting measures and deployed through the different interventions? Yes. Do these measures need to be scaled up by all players? Yes.
By preparedness, what's our measure? Is it that we're having discussions now, or that the measure is in place and this is it? It's on the shelf.
Perhaps it would be then how I articulate this. A discussion does not mean, you know, a cup of coffee and people having, you know, a cavalier discussion. This means interventions that are being budgeted for, that are ready for deployment.
All right, and that's why I'm talking about. In my interpretation of it, if you're having the conversation now, then you're not prepared.
Exactly, and
You're
that's how it
working
would seem,
on
right?
preparation.
Not necessarily. You could be prepared, but you are having discussion on further preparedness. The issue, as I see it here, is this. Dr. Mwangangi has told us with clarity that this particular box, we've ticked everything.
We're checking the boxes.
But we don't know. Now, if someone said, this is communication, we are in discussion, what we can tell you now is this. But give us a week, give us 10 days, give us 3 days, we will tell you this. If you make a blanket statement and say, we are working on it, you've told us nothing. We are not informed. We are exactly where we've been all along. Every point, every time there's information being given, a timeline of sorts, so that people understand that, okay, this is what we're dealing with now. This is what we expect next. Now, perhaps I'm saying something that the government is again not prepared to do, because it may not fit into the strategy or the plans that they have. These children whom we call Kenyans are actually a lot more resilient than the government understands. A little truth won't kill us.
Right.
It also won't throw us into a panic. It isn't the first time people will have died in this country. It isn't the first time we'll have had a pandemic. We had HIV. Scary thing. People died. 32 million around the world. We still have it. Malaria kills. We still have it. Pneumonia kills. We still have it. TB kills. We still have it. So this disease is just...
We can handle it.
It's joining
we can
the
handle
queue.
The information.
Yes. We can handle it.
This is a Situation Room, Kenya's biggest conversation. Dr. Mercy Mwangangi is the Chief Administrative Secretary in the Ministry of Health. She's here with us for a couple more minutes. When we come out of this short break, we'll ask her just to give us a message to the public. Now we've been asking what the government is doing. Now we need to talk about the rest of us. What is it that we ought to do? And we'd like the government to tell us what we need to do, what we ought to know, what we need to do, the kind of seriousness with which we need to treat this matter. We have Dr. Mercy Mwangangi, the Chief Administrative Secretary in the Ministry of Health. She's here with us. She's been responding to very many of our questions and concerns. Now, Dr. we need to talk to all of us as Kenyans, right? Kenyans are you and I, our brothers, our family, our cousins, nephews, nieces, children. But looking at the way people have been behaving since the first time, this case was announced, and the CAS has been saying, look, we need to take immediate measures as ourselves, have social distancing, avoid, make sure that you wash your hands. And then observing, even on Friday, when the CS was saying, we're going to lock down bars, and people are still going to clubs in large numbers. What is it that you'd like to tell Kenyans? Get annoyed, please. Just get annoyed and speak.
Permission granted.
Well, thank you for that permission, but I think we've been annoyed for some days now. What's happening is that we've had different people try to ask us what exactly is social distancing. And I think one of the key measures that Kenyans need to understand is that when you're huddled, in a gathering at night in a bar, that's not a necessary huddling of a gathering, right? And the idea is, and what the data tells us and what evidence tells us is, your number one guard against, COVID-19 would be the hand washing measures. And I think we've seen different people give instructionals on how this should be done. We've had WHO deploy an instructional video on how this should be done. Allow me just to remind Kenyans, any basic soap that you have at home with flowing water, and we've seen some creativity in the matatu industry and in different areas in the country. I think I even saw a jerry can behind a boda
Yep.
in the media. Wash your hands, that helps. Two, for those who may require, sanitizers, and this is in places where you may not have access to water, for example, say in an office space or in an environment where you're in work and you're still maintaining that social distance even at work, we are advocating for the thorough cleaning of your surfaces. We're being told that this virus actually lasts for up to even 3 days on a surface. So it would be useful, yes. That's what the latest paper tells us, scientific paper, that even when you clean, we're advocating that you're wiping down your surface with disinfectant every 2 to 3 hours. So you could be here like we are here in the station, and this is a very well done station. You could touch this surface and touch your face. You can imagine if this wasn't disinfected every 2-3 hours.
Can I ask
What
a
do you
question there as you're
use?
going on? Because people would want to ask then, what is this disinfectant that should be used?
Yes. So we are now advocating for 3 types of, should I say, agents that have disinfecting power. The first one would be 70% ethanol, and there are instructions again in how you can utilize this. I do have, what I'll do is, if you allow me, I'll share with you a pack, an information pack, which you can help transmit to Kenyans. This information pack has how you mix up the ethanol to be able to have that effect. JIC, and forgive me for using that word, but this is what most Kenyans understand. So by no means are we advocating for that brand, but saying any bleach, anything that has sodium hypochlorite, which is the agent, if mixed 1 to 6 parts, and why we're avoiding to perhaps say this is because we've noticed in the market that there are different bleach concentrations that are being sold. So if you read the bottle of bleach at the back end, it has how you should mix it, follow those instructions. But for the general bleach that is available in our households, we're saying 1 to 6 parts. Spray it, leave it on for 30 seconds. We've had Kenyans who are spraying and washing. You know the way you wash and pour a bucket? That's actually not helpful. We are actually saying let the disinfectant stay on the surface for at least 30 seconds to be able to interact with the fatty layer of the virus. So that's important for Kenyans to know. The third one is hypochlorite. If you remember, there's this black bottle in the supermarkets. Hydrogen peroxide. The very black bottle in supermarkets that is there. Again, there are recommendations at the back end of how to use hydrogen peroxide. That's another agent that's working. So those 3 things, Kenyans, bleach, alcohol, that's 70%, and hydrogen peroxide. We've had questions in the hotline. Can we use vinegar? Can we use
methylated spirit?
Exactly. Those have to have, so for methylated spirit, it's a compound of alcohol. If it's at 70%, it works. And that's why we're advocating primarily for what is most available in homes, which would be the bleach. That's more or less readily available in the public. The other element within which Kenyans need to realize is even as you wipe down surfaces, remember of what you call the high touch surfaces in your home, right? The switches. People are wiping down, kitchen counters, but forgetting that they touch switches.
Doorknobs.
They touch doorknobs. Even car doorknobs as you get in steering wheels. So anywhere where you have engagement with your hand, it's important to wipe down that surface. The other element that we're saying is if you should feel that you have these symptoms, right? You're having chest disease symptoms. You're having a cough and the cough is dry, and you're having a high temperature. And for us, the biggest indicator is that high temperature, because most patients in China and Italy, from the recent data, all have spikes in temperature, high temperatures, and then difficulty in breathing.
What's
if
high
you're
temperature?
having a high temperature is when you have a very high fever. You're very hot. And part of this is actually your body trying to fight the virus. So
And
what
when
we're
measured,
noticing,
what numbers are you looking at?
so normally this would be fevers above 36.5 going all the way up to 37.5 and above. But what we're saying is usually you would know when you're feeling a little bit, feverish. You'd know when you're feeling flushed and you're hot, and it's associated then with, the cough, the dry cough. You would know. Now, we've had an interesting question again from Kenyans, because remember, we're still having the other flus.
Yeah.
The other coughs are still
Yeah, the
happening,
common colds.
the other colds, the common colds are still there. So what should I do when, my nose is running? The last study, again, and like I said, it's a very new disease, and so it's a very dynamic situation. I think yesterday there was a study that was released that was saying that as opposed to the normal cough and colds, most of the COVID patients are not presenting with a runny nose and the sniffles. You know when people are, having their runny nose. So that's one of the distinguishing factors. So what we're telling Kenyans, do not come to the health facility just when you feel, you have that common cold. Call the hotline, and the hotline will walk you through to when you need to come in to the health facility. And why this message is important, and I really do appreciate, I think today, from our conversation today here, I can see how we need to ramp up our communication and make it more targeted, is that if you rush to the health facility, you will end up overwhelming the facilities, and they won't be able to respond to those critical cases that they need to respond to. So that's quite, important and necessary. Other things that people are asking, the ginger concoctions, I think we've had that a lot in the call center. The ginger concoctions and the garlic gingers, dawas, vitamins that people are, running to the supermarkets to buy, those do not work. Eat your normal balanced daily diet, and that will be sufficient in terms of, protecting your immunity as should be. Yes.
Let's talk about the call centers and how they're managed.
Yes.
So
Yes.
the number is 719.
Right.
That's the number you dial. So what should you expect to hear when you call that number?
Right. So when you call 719, you will be prompted through a message prompt, one that enables you to be able to utilize Kiswahili or English. And then you'll be able to follow the instructions, and so one, we've programmed it such that it has an information pack in there. So if you just want to know what is COVID, call 719. If you want to know how it's transmitted, call 719. If you want to know how to protect your family, the measures I've talked to about today, how to disinfect, we'll be having a prompt on how you go about it. Call 719. Now, there's the final patient, or client who may be calling who has a fear or an anxiety that they may be unwell. When they do call 719 is connected to the 39 isolation facilities we have across the country. So we are then able to determine, are you a case that therefore requires to be redirected to a health facility?
Right.
Again, through 719, we're in discussions, with more partners to ramp it up. I think you'll be seeing the launch of another second call center within this week to be able to, serve more Kenyans, and to be able to also divert, should I say, the number of traffic calls, because we are getting about 2 million calls a day in the call center
That's
currently. So we're trying to see how we can divert and, have more and more Kenyans being able to access that facility. Not to preempt it, but we will also be, should I say, ramping up our communications through the launch of different initiatives this week. There'll be a website that has what we're calling a chatbot. You know, the chatbots
Yes.
where you're able to sort of communicate and, you know, ask questions. I think you saw WHO launching the WhatsApp line.
The Ministry of Health
We'll
in
also
South
be doing
Africa,
the same thing. So Kenya will also be deploying the same WhatsApp measure, which we find reaches more people within the country. We've had also a team coming in to do videographic translations for people who are deaf,
Right.
who therefore then would not be able to call the hotline and, you know, relay any concerns that they may have. We do have also teams making braille, should I say, information pack
Yeah.
for people to be able to read on and see how they're able to engage.
Engage.
We have the Red Cross supporting us in community deployment using some of the platforms that they have together with AMREF. Johnson & Johnson is supporting that as well, and they'll be deploying messages. We are hoping that we can reach each and every household. Yesterday, I think you heard that the National Administrative Service, in terms of police, will be going around and we'll be trying to engage with communities to also pass these messages. But the main, if it's, you know, the starting point where you really want to know more about this, 719 is the number to call.
To call.
Yeah.
Okay.
So,
Thank you very
Daktari,
much,
Before
Dr.
you run, the message to stay home, is there any plan for social protection? Because staying home does not make sense for somebody who lives hand to mouth, who has to go to work in order to eat, because somebody would rather go out than stay in the house and watch their children starve to death. What is the plan for social protection?
Right. So, and that's a very good question, Daktari. Like we know, you know, most Kenyans, you know, go out to fend, and not most people work, you know, in an office environment where they're able to perhaps use their laptops at home or you know, work and engage productively from home. What we've seen is that different countries are trying to, you know, decide and weigh situations and see if we should offer that assistance, when would be the appropriate time to have it in place and for how long. Remember, right now, one of the biggest questions which I don't think we've, you know, validly discussed it would be, and not just here but across the country, is when would this end?
Yeah.
And the question is, we don't know.
We don't know.
And no country knows. So we don't know how long we are deploying these measures for, meaning because there's that time frame of time, and perhaps that, you know, explains our government's response to this. We're trying to see how do we most cushion the Kenyan and be ready to actually cushion when that is absolutely
critical moment.
necessary. Yeah.
Dr. Mercy
Thank you.
Mwangangi, thank you very much for joining us today.
Thank you. Thank you so much, Spice FM. Thank you.
Thank you so much.
We'll invite you again, of course, in the course of this. Keep coming back. Don't
Ready to.
get tired. Keep coming back because people will be wanting to get more and more information.
Yeah.
Have a good day, Dr.
Thank you. Thank you so much.